Good evening, friends. I am Dr. Vineet Shah from Apollo Hospital, Ahmedabad. I am a cardiac physician. Today, we are discussing very important topic: care at home after a heart attack. Heart attack, it's a very terrific word for a patient and patient relative. So after heart attack, patients and patients relative are very depressed and they require counseling, further advice, future healthy plan, health attitude, and multiple things. So care at home after a heart attack has to be start with the discharge of hospital. So it start in a hospital only. So discharge from the hospital, most people can go after about 3 to 5 days of hospitalization in a normal, uncomplicated case. If patient has a complication and multivessel disease and requires surgery, then patient has to stay for 7 to 8 days after bypass surgery, or in a complicated cases like a IABP balloon pump assistant, ventilation, ventilator support, and that patient require more days of admission. So before leaving the hospital, one important thing is for a patient and patient's family is to understand the discharge plan and further healthy attitude. Make sure all your questions are answered and get written directed for taking all your medications. Either it's a newer medications or older medications. Understand your medications. That is one important goal. After a heart attack, it is common to start new medications like antiplatelet, high dose of statin. And also, doctor has to adjust some medications, old medications, doses of diabetic, hypertension. So what patient has to take care for medications? Most people who have had a heart attack are sent home with a prescription of multiple drugs. It is important to take each and every drug exactly as directed by doctors. Some of these medications can help you to live longer and other help to prevent or treat recurrent symptoms, or it for a prevention of blockage of coronary arteries or chest pain or other symptoms and heart failure. So aspirin, it's a one important medicines, help to prevent future blood clot and decrease the risk of death after a heart attack. Antiplatelet drugs such as clopidogrel, ticagrelol, prasugrel are given to people who have had a stent implanted or receive clot busting medications to open up a blocked arteries. These drugs are given with aspirin to prevent clumping inside the arteries. What happens after implantation of stent? There is a chances of clumping of platelets or clot or thrombus in stents. So antiplatelet aspirin can prevent that. So stent is a foreign body. So if patients stop antiplatelets, then stent blockage due to active or sudden development of clot or thrombus. So do not stop aspirin or antiplatelet like a ticagrelol, prasugrel and clopidogrel without first checking with your heart doctor. This is important, very, very important. Even if you are seeing by a different doctor, like a gastroenterologist, surgeon for some another complications, like a dentist for a tooth extraction, sometimes a doctor or nurse will tell you to stop your medications prior to procedures like a tooth extraction, colonoscopy, any surgery. However, this may be unsafe because of there is a chances of clot formation inside the stent and sudden development of heart attack, even sudden cardiac death. So you should discuss it with your heart doctor before stopping any of the medications. Second important medicine is beta blocker like bisoprolol, metoprolol is a medications that protect your heart from stress and can prevent future heart attack. It can slow your heart rate. It can take weeks of your bodies to get used to a beta blocker. The dose may be needed to change depend on your clinical scenarios. Third medication is nitrate. Nitrate like isosorbate mononitrate, isosorbate dinitrate are medications that dilate your coronary arteries, bringing more blood to the heart muscles and are used to treat or prevent chest pain. Nitrate should be taken exactly as prescribed by your doctor. Mostly dose of nitrate is in morning and late afternoon. Third important medicine is ACE inhibitor or ARB like ramipril, enalapril, lisinopril, losartan, telmisartan and newer ARNI means sacubitril valsartan combination. So what the mechanism of it and how benefit it is, it better after a heart attack and decrease the amount of damage from a heart attack. It may also help prevent, that is very important, it is help to prevent heart failure. So ACE inhibitor are also lowering blood pressure also. Another medicine group is statin. That is very important. Nowadays, statin, atorvastatin, rosuvastatin, it's a primary drug for any heart disease or IHD patient. So it's a medicine that helps to lower bad cholesterol level and can help and prevent heart attack or stroke, because statin helps stabilizing fatty deposit inside the artery that can cause heart attack. So they are often given in a high dose when patient has a heart attack. Even patient of heart attack, even their cholesterol is low or normal level, that patient also require statin medicine as a future prospect, that is prevent future event of heart attack. So now we are going to discuss cardiac rehabilitation. That is very important thing. Nowadays its terminology famous name as a cardiac rehab. So the program can improve your heart ability to function. It's lower your heartbeat, so lower your heart stress, reduce your risk of dying or complication from heart disease. There are major three components of cardiac rehab or cardiac rehabilitation. One important thing is exercise. Second one is reduce risk factors. Third one is deal with the anxiety, stress and depression. You are most likely to benefit if you participate in all three parts of rehabilitation. However, if you cannot participate in all, you has to discipline for exercise and to reduce the risk factors. Exercise. Exercise is known to improve cardiovascular health. Although nearly everyone can safely exercise after a heart attack, but some discipline is required. So the intensity and duration of exercise depend upon the severity of heart disease. Therefore, the first step in an exercise program is to determine your risk of complication from exercise. This is usually done by performing exercise tests on a treadmill. What in our clinical routine scenario, we advise patients to come after 7 days of a angioplasty. So when patient came after 7 days, during that 7 days, he require only routine activity of daily living, no any stressful exercise or walking. After examining on a follow-up, we will recommend them to start exercise. If patient has an acute heart attack, then we will advise them to wait for a 6 to 8 weeks for some stressful exercise, because that is a routine healing period for any body tissue, and that's like a heart. So after heart attack, there is a requirement of some healing of heart infected tissues. So after 6 to 8 weeks, they can start exercise, and it's always in stepped up manner. So the exercise should use large muscles group and include aerobic exercise. Walking, jogging, swimming, cycling and stair climbing are some examples. You can also build exercise into the daily routine like taking brisk walking and playing with the children or grandchildren. Over time, most of people can gradually increase the intensity of exercise in their workout, and always it's in stepped up manner. So start with some minutes, around 10 to 15 minutes in an initial stage, then it's increased by 5 to 10 minutes every week. Our routine scenario is after 3 months of heart attack, patient has to walk 40 to 45 minutes in a moderate speed. So the recommended frequency of exercise is to 3 to 5 times a week. Each session should include the following. Always there is a warm-up phase of around 5 to 10 minutes, a conditionally phase of 20 to 30 minutes, and cool down phase of 5 to 10 minutes. Main important thing, avoiding of warm-up or cool down phase can increase your risk of heart related complications. So always it do. So 5 to 10 minutes of warm-up, 20 to 30 minutes of conditioning exercise, and 5 to 10 minutes of cool down exercise. After exercise, more important thing is to reduce the risk factors like smoking, diabetes, hypertension. So number of factors increase your heart risk of developing heart disease and having a heart attack. Reduce or eliminating that risk factor can be helpful even if you already have a heart disease or had a heart attack. So important thing is to stop smoking. Cigarette smoking increase your risk of coronary heart disease and heart attack, and stopping smoking can rapidly reduce this risk. 1 year after the stopping of smoking, the risk of dying from coronary artery disease is reduced by about half, and the risk continue to decline with the more stopping of cigarette. In some study, the risk of heart attack was reduced to the rate of non-smoker within the 2 years of stopping smoking. So cardiac rehabilitation program can recommend a treatment to help stop smoking, such as group program, nicotine patches, gum or nasal spray, or prescribing medications like bupropion and antidepressant medicines. Second, another thing is to treat high blood pressure. So medications to control high blood pressure are often recommended after heart attack, and important thing is control of blood pressure to prevent further that its complications, and we advise patient to maintain BP record and can on that when you are coming for a follow-up. So BP chart like a date, time and BP. I personally recommended in an initial phase every day, every day, at least a single time a day. After that, at least 2 to 3 times a week BP record and come take that chart when patient came on follow-up. So second is high cholesterol. So medications to lower the blood cholesterol level are also recommended by after heart attack like a rosuvastatin and atorvastatin. Important thing is manage diabetes, because diabetes is very important, and to control diabetes is important for a future health and future comorbidity and mortalities. So people with diabetes are at the increased risk of developing complications after heart attack. So tight blood sugar can help reduce the risk of this and other type of complication. So tight blood sugar can achieve by losing of weight, regular exercise, manage your diet, monitoring your blood sugar level. That is also very important. You have to maintain blood sugar level and also frequently checking your blood sugar. So when you came for a follow-up, doctor seen that blood sugar chart and recommended medications. It means depend upgradation, uptitration, or even they can decrease the dose of medications also if you have a well control of diabetes. And taking oral medications or insulin depend on overall blood sugar level. More important thing is diet counseling. Diet counseling is helpful for people who need to lose weight or to reduce cholesterol level. A registered dietitian is the best person to consult about food that are very helpful. Appropriate portion, appropriate size, total calories recommendation, realistic way to change bad eating habit. Most cardiac rehabilitation programs have a dietitian who has good knowledge and experience in advising people who are recovering from a heart attack. Psychosocial treatment. Feeling of depression, anxiety is usual after heart attack. So depression can make it hard to exercise, decrease energy level, that is a major cause of fatigue, reduce your quality of life and sense of well-being. Women, and in particular younger women, are at the especially high risk of depression after heart attack. More important thing is, when is sex safe after heart attack? Many patients are asking these questions, and there many patients are not asking because of their shame. So, an important issue for many people who have had a heart attack is knowing when it is safe to have a sex. In the first 2 weeks after an uncomplicated heart attack, most people are at increased risk of heart-related complications during sex. So, however, this risk continue to decrease at 6 weeks. So I already explained that for a healing of heart, it's required around 6 to 8 weeks. So at 6 to 8 weeks after the heart attack, the area of infarct, area of damaged heart will have achieved the maximum healing. So after 6 to 8 weeks, our heart is somewhat stable. So we are advising sex after 6 to 8 weeks of heart attack if patient has no any complications, asymptomatic, and they are used to manage their daily routine activities. If patient has a complications with heart attack, such as recurrent chest pain after heart attack, abnormal heart rhythm, arrhythmias, and heart failure, like symptoms like a breathlessness, in that patient, we are advise them to avoid sex if patient has symptoms or breathing difficulty. Particularly heart failure patient, decrease heart pumping patient. People in this risk group need further evaluation and also treatment before attempting to have a sex. Talk, main important thing is talk to means patient has to talk with their healthcare provider if they have a questions about their safety to resume the sex. So sexual problem after heart attack are common, occurring in 1/2 to 3/4 of the patient. Both men and women may have a less sex or feel less satisfied with sexual activity after heart attack. A variety of factors may contribute, including side effect of drug, beta blocker, and in diabetes. And another factor is depressions. So fear about triggering a new heart attack or dying during sex, that is usual. So since sexual activity is a type of physical activity, exercise testing can be used to determine if you are at risk of heart problem related to sex. So counseling and discussion is very important after heart attack for a sex when they have to resume. For many men with a erectile dysfunction, in a particularly a diabetic patient, medications like a sildenafil citrate, tadalafil is important, and it's a highly effective. If you use it appropriately, these drugs appear to be well tolerated and safe even after a heart attack. But one important exception in this is if you are taking any medications like a nitroglycerin, isosorbate dinitrate, sorbitrate, then you have to avoid these medications on a regular basis or even occasionally, because this combination of medications can cause life-threatening drop in blood pressure. So it's very important if to take advice from a doctor to take this sildenafil citrate. It's known as a Viagra or Panagra. So always advised by a doctor and take a instruction from a doctor before taking these medications. So this is very important. Follow-up care after heart attack. So following your heart care provider advice and participating in a cardiac rehabilitation program are the best way to recover from heart attack. In addition, it is important to schedule and attend periodical visit. That is very important to prevent complication of drugs also with your doctors. So follow-up care is very important to maintain your overall health. People who have had one heart attack have a significant increased risk of further event. So including chest pain, another heart attack, heart failure, and increased risk of dying. The risk of this problem can be reduced by following recommendation for a rehabilitation, follow-up visit and treatment, regularity, diet, exercise. So over the time, the treatment plan may change as your heart health improve or other medical problem develops. Food to eat, and which food you have to avoid after a heart attack. A healthy heart diet consists of lots of fruit, vegetables, lean meats, skinless poultry, nuts, beans, legumes, fish, whole grains, plant-based oil like olive oil, low-fat dairy products, eggs. These are you can use in a frequency, no problem. They are all low in low saturated fat and empty calorie. As a rule of thumb, make sure your plate is half full of containing a variety of vegetables and fruits. Food to avoid. As a rule of thumb, you will want to avoid excess sugar, salt, and unhealthy fats. So this is especially true after experiencing a heart attack. So which food? Fried food, any fried food, boxed food, canned sugars, candies, chips, processed frozen meals, cookies, cakes, biscuits, ice cream, mayonnaise, ketchup, packed dressing, red meat. You can take limited amount of red meat. Alcohol. You can take a red wine around 30 ml per day, not more than that. Hydrogenated vegetables, oils. For a happy heart, limit your intake of saturated fat and avoid trans fat found in hydrogenated oil completely. Saturated fat should make up no more than 6% of your total daily calorie intake. This is especially crucial if you have a high cholesterol. Second important thing is to maintain your blood pressure, to maintain your diabetes, regular sleep. So how you can prevent heart attack from occurring in the future? The goal after your heart attack is to keep your heart healthy and reduce your risk to prevent future damage to your heart. Take your medications regularly, discipline in your diet, stringent for exercise, regularity in life, regular adequate sleep, and work which your heart is permit. Avoid strenuous exercise. That is also very important. I found many people after heart attack, after some month or some times, they are doing strenuous exercise. So I found there is a sudden cardiac death after strenuous exercise because of that arrhythmias and sudden blockage in a stent because of plaque rupture. So avoid strenuous exercise after heart attack. Even in a stable heart patient also, they have to avoid strenuous exercise to prevent heart attack and sudden cardiac death. Thank you very much. Hello, is there any questions? Heart failure patient to upper 100 milligram and cardiac 6.20 some layer. Mr. Inam, I feel after heart attack and heart failure, patient heart rate has to be maintained around 60 to 70. That is very ideal, and to maintain further complications. So you can take, you can add in your prescription ivabradine medications. Even you can increase your carvedilol dose. It's a 6.25. Mostly it's a BID. So you can increase this to 12.5 and even 25 milligram BID. Highest dose is 25 milligram BID. Please maintain your heartbeat around 60 to 70. Even you can add ivabradine 5 milligram BID dose. Mr. Maharshi Shukla, what difference between good and bad cholesterol? In layman language, what is good cholesterol? Good cholesterol is cholesterol which is coming from blood vessels to liver. So it prevent plaque formation or blockage of blood vessels. And what is bad cholesterol? Bad cholesterol from liver to blood vessels, or it's already generated in a liver and diffuse in the blood, and making it important to build up plaques and blockage. So LDL is a bad cholesterol and HDL is a good cholesterol. So you have to maintain HDL more than 45 milligram of percentage, and LDL after heart attack, if possible, maintain LDL less than 50. At least 15 to 70 milligram percentage is the ideal LDL to maintain after heart attack to prevent further complications. So now I summarize overall after heart attack. Discipline is very important for exercise and diet. Regular medications. Don't stop medications without informing your cardiologist or cardiac physician. Control your blood sugar, blood pressure and cholesterol, and take adequate sleep and rest. Do meditation for a mental peace. Thank you very much.